In this lecture, we're going to continue our discussion of the steps involved with the general interview. And the general interview of a patient or client will continue with establishing an understanding of the medications that the patient may be under and certain allergies. And this just simply starts with a listing of the patient's current medication list. And what the patient has should be compared and reconciled with the medical file of that patient, so as the medications that the patient is taking and understanding does reconcile well with what has been prescribed by their physician. The medication regimen in terms of the dosage, the administration route, the frequency of the doses, and the time of day is going to be important, because the medications will have, or may very likely have, an effect on the outcome of an exercise test and can impact the ability of the patient to exercise. One such example of that medication effect during exercise, whether it's during an evaluation, during a test, or after exercise has been prescribed. The beta blocker is a heart rate reducer indirectly. The beta blocker is prescribed to address high blood pressure, and it acts by reducing heart rate. But during an exercise test, understanding if the patient had taken a dosage that their heart rate would not elevate as much during a test is important for the clinical exercise physiologist to understand. Understanding the allergies, the medical allergy history of the patient, is also going to be an important piece of information that the exercise physiologist should have. In terms of the patient's medical history, an understanding of past medical problems, even if those medical problems are not the chief complaint, will have an impact on the ability of the patient to engage in an exercise test or to exercise after the prescription phase, and when those medical issues occurred. Some examples include here coronary artery disease. If there was a recent assessment of the function of the patient's left ventricle, is also going to be an important consideration prior to conducting any type of exercise test. Have there been any cerebral, brain, or peripheral vascular disease? Because with exercise there's a large redistribution of blood flow, and if there is some condition affecting the vasculature, that is an important point that the exercise physiologist should understand. Does the patient suffer from a restrictive disease such as asthma, or an obstructive disease such as COPD or chronic obstructive pulmonary disease? Will affect the patient's ability to ventilate their lungs as they're exercising. And of course, if there are any musculoskeletal injuries or existing conditions such as rheumatoid or osteoarthritis, may have an effect on the ability for the patient to carry out an exercise test. The family history is an important component, especially as it relates to first-degree relatives. And first-degree relatives include parents, siblings, or offspring. Because there are heritable disorders that get passed from generation to generation that are genetic-based and are heritable, that are important for the clinical exercise physiologist to understand. Some of these include diabetes, breast cancer, hypercholesterolemia, which is high blood cholesterol, have all been linked to family traits and family patterns. The social history is relating to the behaviors and other activities that the patient habitually takes part in. So this includes tobacco use, any use of recreational types of drugs, including marijuana, other illicit drugs such as cocaine, alcohol usage will have an important consideration when it comes to exercise prescription. The living status will give the exercise physiologist an understanding of what sort of physical demands may be placed or other stressors may be placed on the individual. So what type of occupation does the patient or client engage in? Is it one that requires excessive sitting or a high level of manual activities? Does the patient or client walk to work? Do they drive? Do they take public transport? And that will have an effect on how much exercise should be prescribed given their current amount of physical activity, and whether the patient is married or single can also play a role in the exercise prescription part of the exercise physiologist service. The routine or leisure activities, prior physical activity, or exercise habits will play a role in the amount of exercise that will be prescribed. And the nutrition patterns are also going to be a very important consideration. Does the patient typically eat on the run? To what extent does the patient consume fast food versus making their own meals from home? And to what extent is the patient aware of the importance of nutrition as it relates to their health? And sleep patterns are also an important consideration to keep in mind. Estimating the aerobic capacity by history is summarized here in this table, and the questions here relate to the types of activities that the patient engages in during the day, and these types of typical activities are related to estimating what's called the metabolic equivalent, or MET, of the task. And this is the MET is a convenient way, a convenient quantification of estimating energy expenditure. So on this table, as we see, getting dressed without stopping has a value of about 2 METs, and we'll define MET here shortly. If we step up the activity to the bottom of the table, where we see running, playing basketball, or swimming, the metabolic equivalent is approximately 9. So it's quite high. So we ask the question, what is a metabolic equivalent? A metabolic equivalent is, as I indicated, a convenience scale that estimates the energy requirement for a given task. The one metabolic, or one MET unit, is what is typically assigned under resting conditions. So the oxygen consumption, oxygen utilization, on average for adults is estimated to be about 3.5 liter or milliliters of oxygen consumed and utilized per kilogram of body mass per minute. That's under resting conditions. And as activity elevates above resting, the oxygen consumption can be conveniently estimated as a multiple of the resting one metabolic equivalent. So as an example, if we take a look at a task such as moderate jogging, we see that moderate jogging is assigned a value of 7 metabolic equivalents. And so if we multiply the metabolic equivalent under rest of 3.5 mLs per oxygen per kilogram of body mass per minute by 7, we see that on average we can assume that the adult will expend, or will rather consume, approximately 24.5 milliliters of oxygen per kilogram of body mass per minute. Now, this is not a perfectly precise value, but during the general interview, by taking a history of the typical activities that the patient engages in, the clinical exercise physiologist can get an estimate of how much energy and how much through oxygen consumption that the patient expends. As we move on to the physical examination, the clinical exercise physiologist should first get a sense of the general state. And this occurs by just carefully observing the patient or client. Are they comfortable? Are they engaged? Are they somewhat cheerful during the general interview? Or do they appear distressed, anxious? Do they appear fatigued just walking into the room? Do they appear frail? These are all pieces of information that the clinical exercise physiologist should take into consideration when it comes to testing or prescription. Something that's a little bit more objective here is the taking of blood pressure. And the patient is typically considered hypertensive if their blood pressure recording exceeds 200 millimeters of mercury over greater than 110. They are considered hypotensive, low blood pressure, if they record less than 90 millimeters of mercury over 60 millimeters of mercury. And these are the standard values to define somebody as hypertensive or hypotensive. The hypotensive patient is one that, or the hypotensive blood pressure reading is one that's concerning because it is commonly associated with symptoms such as lightheadedness or dizziness, because without sufficient pressure, not enough blood is traveling at a fast enough rate throughout the body, including the brain. Measuring heart rate under resting conditions is important to establish if the patient has a very high resting and unexplained heart rate greater than 100 beats per minute, or if it is excessively slow, less than 40 beats per minute. And the key aspect here is if the very high resting heart rate or the very low resting heart rate are both unexplained. In terms of respiratory function, in a similar manner, it's important to understand that under resting conditions, is the respiratory rate greater, little typo here, greater than 20 breaths per minute, or less than 8 breaths per minute. And so these are two other important considerations that will impact the successful execution of an exercise test. So this ends our second video of our first part of Unit 3.